Dr. Heidi Mendoza. Heidi is a clinical biochemist in an acting consultant post in NHS Highland. She works to support remote and rural hospitals in the Scottish Highlands. Heidi has a passion for using IT to change and enhance laboratory workflows and improve patient care. She has been a clinical biochemist in the NHS for 13 years, working in Dundee and Inverness. Today, she's going to describe for us the challenges of delivering a remote and rural service during COVID-19.
Thank you. So I'm Heidi, and I'm working in Regmore Hospital in Inverness in a blood science department, and I've been asked to tell you a bit about how we've delivered our remote and rural service during COVID. NHS Highland is the biggest health board in the UK by land mass. We are a third of the land mass of Scotland, and we are 20% larger than Wales, but we have a really small population size. We're only 320,000 people, which is roughly equivalent to the city the size of Belfast. Road networks are a big problem in Highland. We have no motorways, and due to our mountains and geography, some of our locations are only accessible via single road. This makes transport a big issue, which I'll speak about later in the talk. If you look at the map, you can see that the blue and red stars, which are practices, lie on our coastlines. And that means that patients and their samples have journey times of about 2 to 6 hours to get to one of the larger hospitals. We also have patients coming from the islands who have to take boats and planes to get in for outpatient appointments. And when you have journey times of greater than 12 hours, it's not simple or straightforward to repeat a sample. It's really important for our laboratory to get it right the first time. The circle shows our main lab in Regmore Hospital. We're a pretty typical small lab running a 24-hour shift system for biochemistry and hematology. On any given day, due to out of hours and part-time staff and annual leave, you would expect to see 3 biomedical scientists or BMSs in for chemistry and 3 for hematology. The purple and blue circles show our remote and rural labs in Fort William and Wick. They're multidisciplinary labs. They offer biochemistry, hematology, and blood transfusion services on a 24-hour on-call service. There are only 3 BMSs in Fort William and 4 in Wick. All 3 of our labs are accredited by UCAS, which is a huge achievement given our geography and staffing challenges. We were very lucky in Highland in that we had a very low COVID infection rate and very few hospital admissions. But we didn't know that at the start of the pandemic, so we had to plan for a much higher rate of infection. We expanded our 8-bed ITU to 24 beds, and we made major changes to our hospital equipment. We put in much more point-of-care testing, more ventilators, and we had to increase the oxygen capacity of the hospital. In order to reduce service pressure, we cancelled all outpatient appointments, we cancelled non-essential surgeries, and we reduced or stopped early cancer care services. So examples include colposcopy for cervical cancer and endoscopy for colorectal cancer. Our GPs ceased chronic disease monitoring. There's been a lot of indirect impacts of COVID on NHS Highland patients. We noticed early on that patients are presenting very late to A&E. And there are 2 reasons for this. One is that patients themselves are frightened to come into hospital because of COVID. And the second is that these patients would normally have been seen by their GP earlier in the course of their disease, but because the GPs weren't seeing patients, they presented very late to A&E. As we've returned to the new normal and started diabetic monitoring again, we've noticed that diabetes control has been particularly poor in adults and children. And we think this is due to the lifestyle, diet, and routine changes that happened during lockdown. From a laboratory perspective, we've noticed that when we phoned out critical results, patients are not being brought in and managed in secondary care as usual. When we followed this up, we found, again, there was 2 reasons. One was that the patients had declined to be brought into hospital, usually due to fears around COVID. And the second is that secondary care clinicians didn't want to bring them in if they considered them in a high-risk category for contracting COVID. As you can see, these impacts will be felt in the long term for our patients with respect to chronic disease, mental health monitoring, and cancer. The impact on our laboratory service has also been profound. By the time lockdown started, our samples had dropped to 30%. We handle all our COVID samples or suspected COVID samples in a microbiology safety cabinet, which has increased our turnaround times for our COVID samples and also had knock-on effects of increasing our turnaround times in our non-COVID samples. We made major changes to the IT and the infrastructure of the lab in order to adhere to social distancing. The impacts were really felt on our small laboratories. So on the right-hand side of the slide, you can see our 4 BMSs from WIC. And when you have such a small number of people running a service, it's really vulnerable to staff illness, in particular the blood transfusion side of the service. For this reason, many of our staff, or the few of our staff in the remote and rural labs, have isolated themselves from their families in order to ensure that they were able to deliver the service. One of our BMSs, Laura, she isolated from her family and her toddler in order to be able to deliver the service up in WIC over the first few months. And in the middle picture, you can see Prince Charles thanking Laura and the WIC lab staff for their dedication during the service. As you can imagine, in the last 6 months, staff stress levels have been very high. At the best of times, transport is a challenge in Highland. This slide shows one of our most famous roads, the Balachnaba, or Pass of the Cattle. It rises over 2,000 feet and has a 25% gradient in places. Although you can take an alternative route round, it'll significantly add to your journey times. You can imagine that this and a lot of our other Highland roads become impassable during the winter time. Since the start of the pandemic, in Highland, we have been unable to send frozen samples to England using commercial couriers. On the few times we've tried, the samples, although they were sent on dry ice, arrived thawed at the lab in London and were unsuitable for analysis. And these were samples from our cancer patients to monitor the success of their therapies and their risk of recurrence. We've tried with other commercial couriers and with the Royal Mail and had the same sort of problems. On the right-hand side, you can see Ross Sharp, one of our local heroes and a volunteer from the Highland and Island Blood Bike Service. This is a fantastic charity with volunteer motorbike riders who've been riding all over Highland for us, delivering COVID testing swabs, patient samples, reagents, and blood products. In fact, it was the blood bikers who volunteered to take our frozen samples to a lab in Glasgow. The lab in Glasgow then sent our samples on to London using their courier service. So I'm going to finish off by telling you a bit about test implementation during COVID. Procalcitonin is a really well-established test for the investigation of sepsis and to guide antibiotic therapy. We know that COVID is not increased in the majority of adult patients. Procalcitonin is not increased in the majority of adult patients with COVID. If it is increased, it suggests that the patient has a secondary bacterial infection, and this information can be used to start or change antibiotic therapy and hopefully improve their outcome. At the start of the pandemic, our microbiology and ITU consultants approached us and asked if we could get procalcitonin into ITU for our COVID patients. I have to say, normally in the NHS, it takes us 3 to 6 months to implement a new test, but we implemented procalcitonin in about 3 weeks. And we did this with help from our instrument manufacturer, EQA providers, and other Scottish hospitals. In this case, it was a lab in Tayside in Dundee who sent us procalcitonin reagent and shared anonymised patient samples with known values so that we could verify our assay quickly. So I'd like to finish off by highlighting a few of the key learning points that have come out of the last 6 months. The first is that the key to resilience and innovation in any crisis is our staff. It's our staff who came up with the ideas, the workflows around COVID sample handling, and it's our staff who have carried and will carry our service in a crisis. The second is that, like Joe and Connell, we found that the laboratories can adapt and change quickly when we need to. It's a bit surprising because historically we're known for working hard and doing more, but not known for our ability to change quickly. We have to continue that for the future. The third is that our NHS networks are incredibly powerful. I've highlighted a few examples for you of how other labs have helped us out by sending our samples, by lending us reagents, and by sharing anonymised patient samples for assay verification. it would not have been possible to continue to deliver the service during COVID or make changes without help from the other Scottish labs in Dundee and Glasgow. And last, the crisis does provide an opportunity to develop and improve the services. We've got really challenging times ahead, and it's important that in spite of those challenges, we still look for ways to improve and develop our service. Last, I'd like to say a thank you for listening. If there's anything that I haven't covered or that you would like to discuss, I'd like to hear from you, and I've included my email on the slide for you. Thank you.